I think it's really important for public health to play a role in informing the community, and I think it makes people feel really good to know that there's a department that is working through prevention, behavior change, whatever it may be, to make sure that we have healthy individuals, healthy families, and a healthy community.
I don't think there's a magic bullet to cure all diseases. I feel like preventing someone or educating someone from either getting injured or getting some type of disease is the best thing that you can do.
One of the things that really made me become so interested in public health is the direct contact you can have with the community in the public health department in ways that are going to make people healthier individuals and healthier as a community as a result.
Hear their stories and feel their stories that, number one thing, they want to protect themselves and their children. And they're basically pleading and asking, how can we do this? You know, we need your leadership, we need your experience. And by providing them that education, by providing them avenues what they can do to actually help themselves, such a big feeling.
Becoming accredited is going to be so important department-wide, and specifically for the communications team, I think we're going to be able to tell on another level, do our messages work in reaching the community? And more specifically, do those messages work in reaching specific populations? And we will be able to constantly evaluate and improve the quality of not only creating and developing those messages, but also being able to really assess whether those are working.
Being an accredited institution, I believe that it's just going to open the doors for future grant funding. And then, of course, with more grant funding, we'll be able to have programs and projects to be able to serve our community members here in Santa Clara County. So I think this accreditation process is really key and vital to the community and with the Public Health Department.
Basically, everything that we deliver to the community is going to be delivered on a higher level, because we're going to be able to constantly be checking that and assessing what works and what doesn't. And I think that's going to mean a lot for the department as a whole.
There's a Japanese term called Kaizen, called continuous improvement. You want to be able to evaluate what you're doing right now in the community, because if you don't, how do you know how can you improve for the next time? With this component, if we evaluate ourselves, get better data, get better interventions, it'll be a better way to serve our community residents here.